Hello. Today we're going to talk about the mental health crisis in rural America and why it is everybody's problem. 20% of the United States population live in rural areas. Imagine breaking your leg and having to drive 3 hours just to see a doctor. Now imagine experiencing a severe mental crisis, but the nearest therapist is just as far away, and you don't even have reliable internet connection to schedule a video call. For millions of Americans living in rural area communities, this is not a hypothetical scenario. It is an everyday reality. While rural areas are often celebrated for their peaceful landscapes, close-knit communities, and agricultural heritage, there is a hidden epidemic quietly devastating these regions. According to the Centers for Disease Control and Prevention, nearly 20% of the United States population live in rural areas. Yet these communities experience significantly higher suicide rates than compared to urban centers. Today, my goal is to inform you about the growing mental health crisis in rural areas. We will explore the primary barriers that prevent rural residents from receiving care, examine the profound effects that crisis has on individuals in their communities, and finally, we're going to look at some of the current efforts and innovation solutions being implemented to bridge this critical healthcare gap. "60% of rural Americans live in mental health provider shortage areas. To understand the rural mental health care crisis, we must first look at the massive barriers standing between people and the help they need. The most pressing issue is a severe shortage of mental health professionals. The Health Resource and Services Administration reports that over 60% of rural Americans live in the designated mental health provider shortage area. In many rural counties, this is not a single practicing psychiatrist or clinical psychologist. When care is available, it is often located in a distant urban center, creating a massive geographical and transportational barrier. It is incredibly difficult to maintain a weekly 45-minute therapy session when it requires a 3-hour round trip. In a community where everyone knows everyone else, walking into a therapist's office or parking your truck outside a mental health clinic is highly visible. Many individuals fear being judged or losing their standing in the community, leaving them to suffer in silence. Furthermore, socioeconomic factors deeply compounded these issues. Rural areas generally experience higher poverty rates and lower rates of health insurance coverage. Even if a person overcomes the stigma around the distance, they may simply be unable to afford the out-of-pocket for the care. So what happened when these barriers prevent people from getting help? The ripple effects are devastating. For the individual, untreated mental health conditions often worsen over time. Without access to professional therapy or psychiatric medications, many turn to self-medication. This reality has intimately intertwined the rural mental health crisis with the ongoing opioid and substance abuse epidemics. We see higher rates of alcohol dependency and prescription drug abuse in these isolated regions as people desperately search for ways to cope with anxiety, depression, and trauma. The burden that falls heavily upon families. Relatives often become de facto caregivers, managing severe psychological crisis without any formal training or support. This creates a cycle of generational trauma and the economic strain on the household. The agricultural sector, which forms the backbone of many rural economies, have been hit particularly hard. Farmers face unique stressors, unpredictable weather, volatile crop prices, and immense debt, which has led to suicide rates among agricultural workers being significantly higher than the national average. Despite this grim reality, it is important to recognize that the situation is not hopeless. There are active efforts and promising solutions currently being deployed to address these challenges. One of the most talked about solutions is the expansion of telehealth. However, telehealth relies on broadband internet and utility that is still lacking in many rural areas. Consequently, massive federal and state grants are currently being directed towards rural broadband infrastructure to make telehealth a very viable reality for all. Another powerful strategy is the integration of behavioral health into primary care. Because rural residents are most likely to visit their general practitioner than seek out specialized psychiatrists, clinics are beginning to place mental health counselors directly inside the family doctor's office. This not only reduces the need to travel, but it also bypasses the stigma of visiting a dedicated psychiatric facility. Additionally, community-based training programs like Mental Health First Aid are teaching non-professionals such as teachers, clergy members, and local agricultural extension agents how to identify the signs of mental health crisis and safely guide their neighbors towards professional help. The mental health crisis in rural America is a complex issue driven by severe lack of providers, immense geographical distances, deep-rooted stigma, and economic hardships. As we have discussed, the lack of accessible care leads to tragic outcomes for individuals, families, and vital industries like agriculture. However, through the expansion of telehealth, primary care integration, and community education, steps are being taken to bring care to those who need it most. The rural landscape is often associated with peace, independence, and tranquility, but for many who are struggling silently, it can be a landscape of profound isolation. By educating ourselves and bringing attention to this disparity, we can advocate for a future where one zip code does not determine the access to life-saving mental health care. Thank you for listening.